Hello and welcome to the information video on agenda point 6 on the document of the Advocacy and EU Matters Working Group on professional autonomy in the national healthcare system. The Advocacy and EU Matters Working Group did a survey to establish a baseline dataset on the professional autonomy. This was approved by the 2008 ERW-CPT General Meeting and is in line with the strategic objective number 2. The methodology of the survey was that it was an online survey with multiple choice questions and some open questions, and the member organizations did have the possibility to give feedback, check and change their answers. The results of the survey was that we had a 100% response rate. Thank you for that. And we did identify specific markers indicating the professional autonomy of physiotherapists within the national healthcare system. The rationale for this discussion session is that by analyzing the survey data, we revealed some gaps. One of the gaps was the language barrier, and the second gap was the lack of uniform use of terminology. The aims of this discussion session will be to address the lack of uniform use of terminology, and in the second part, to gather information from the member organization. In preparation for the discussion session, we kindly ask you to read Annex 26, which was included in the documents for the General Meeting Part 2, and Annex 9, which was included in the documents for the General Meeting Part 1. The gaps we identified, or the terminology we identified, where there was some lack of coherence between the member organizations, were the following 5 terms: referral, prescription, assessment, diagnosis, and the national healthcare system. In the annex, we provided a definition which we took from either the UN, the WHO, or the European Commission. I want to see in the discussion session if we can use those definitions as a common terminology that we can use amongst the member organizations for future reference in future surveys. We added another box, other identified items, and we kindly ask you, if you, through reading the documents and you see some other terms that we didn't identify here and want to put them up for discussion, please do so during the discussion session. The second part of the session is where we want some additional input on these 4 questions. The first, how can a national organization use the results of the survey? How can the European region use the results? Our third question would be, does the overall result and your result reflect with what is happening in the national healthcare system of your country? And a fourth question would be, is the information of value for future advocacy? I thank you for listening, and I'm really looking forward to engaging in a lively session on Friday the 9th. Take care, stay safe, and see you there.